to the Neurodive Corner, your spot for all things neurodivergent and the amazing people that take care of them. I want to start today's video. I had to pull that off of me, it was just bothering me. So I want to start today's video with thanking our new subscribers. I know of at least 4 that came into our new community today. So all of our top fans, all of our subs, make sure that if you see new names on the channel, that you go and check them out and give them a warm welcome. This is a small community. We are here usually to discuss neurodivergence and talk about neurodivergent people and the amazing people that care for them. And today we are going to talk about a group of people that are extremely underestimated. And I want to start by celebrating and telling all of my peers, happy Social Worker Appreciation Month. March is Social Worker Appreciation Month. And if you are in this field, you know that this job on many days can be a thankless job. A lot of you're in, it can bring a lot of things that that can feel personal, and they're really not. But I always tell people, this is not just a job, it's not just a career. Usually social work to me is a calling, is something that you have to be passionate about. You kind of have to be born into this. And I say that honestly. I'm being as honestly and transparent as I can be. Being a social worker is something that you definitely have to have a passion for. Even if you're faking it till you make it, it's not going to be sustainable. If you don't feel it here, you will not last in this job. Let me throw it back to the chat. So I have at Walker 6536. Thank you. No one here. Well, you are here, so I'm talking to you, obviously. Are you an alien, though? Not human? AI finally took over shit. That's what happened. That's why you're saying who you're talking to. You're an AI bot. That's probably why. Yeah, that's probably the issue. Anyway, so let me say hello to the rest of the people. Adrian Hunter. What is it? Is it trolling day today? Is that what's happening? Or are we in a bad mood? Because I'm a social worker. I can give you therapy if you need, or offer a virtual hug, or I don't know. Do you need some Xanax? What country are you in? It might be cheaper in your country than in our country to get you some Xanax, get you some feel good medication, some Vraylar, something like that. Some mood stabilizer. I love trolls. Keep it up. Keep it coming. Whenever you are somebody like me, that you are neurodivergent, and I'm a Gen Xer, I'm a latchkey kid, you're not going to get under my skin. This is actually kind of fun for me. Hector Melendez. Hi, Hector. Thank you for joining the live. Welcome to the community. Today we have a bunch of trolls, Hector. I've seen you before. So it's up to you. You can join the trolls. the that came in with little D energy today. They are asking what the hell I'm talking about. So I am talking about Social Worker Appreciation Month and the importance of social workers. So if you want to join the trolls, that's what they're up to. If not, I am going to continue talking about what the theme for today is, which is social workers. So, again, this can be a very challenging job. You know, you're dealing with people in crisis, at their darkest, at their worst, when they're going through guilt, when they're going through judgment, when they're going through being at their worst. So, being a social worker is a thankless job. It is very difficult. It could be extremely, extremely challenging. And the problem is, a lot of the times, they are not given the tools to deal with that type of stress, right? So, oh wow, another one? Jesus. So, did all the mentally ill people jump in the chat today? Hmm. Jesus Christ, you guys are angry. I, well, I can't blame people for being angry. I mean, we are definitely in World War III and all kinds of shit going on. So, I'll show you some grace. So, the problem with being a social worker is you give, you give, you give, and a lot of the times you don't know how to set boundaries and you don't practice self care. And you just want to push through because you want to help people. That is in your nature, is who you are. It is intrinsic to your not personality, but to your passions and what you want to do in life and to your purpose in life. The problem is there's a couple of things that come with being a social worker that people don't pay close enough attention and can get you in trouble very quickly. And those are compassion fatigue, which the trolls in the chat obviously have, vicarious trauma, which is when you are experiencing somebody else's trauma as your own. You can have trauma exposure, and that obviously comes when you are constantly exposed to somebody else's trauma. And of course, burnout. Now, compassion fatigue is probably the mildest of the things, and that's usually when you start noticing that you're getting a little cranky, you're having to kind of like push a little harder through your days. You're sort of like not quite yourself at work. You're trying to avoid certain tasks. That's when you're starting to notice that you are suffering compassion fatigue. Now, compassion fatigue is something that, again, if you practice self-care, if you go to a therapist, if you talk to a peer, it is something that you can address fairly quickly and kind of like get back on your game. It doesn't feel great because one of the main things when you are a social worker is obviously um, being able to empathize with others, even when it's people that, you know, for whatever reason, you might not have a lot in common or might be doing things that are actionable to you, that things that don't sit well with you. So again, if you can catch it at compassion fatigue, then you're not in too bad of a shape. Now, when you have trauma exposure, that's a little bit different because now we are talking about an extended period of time to being exposed to traumatic events. When you start experiencing this, you will have the manifestations of trauma as you are living it yourself, you know? Um, so that's one of the main things that comes with trauma exposure is you yourself are now being traumatized because of the amount of trauma that you have been exposed to or the length of time that you have been exposed to somebody else's trauma. Now, when you are exposed to trauma, it is extremely important to get professional help. That way, you can kind of like pinpoint how to manage and how to cope with trauma and what techniques are most effective to you depending on what symptoms you are experiencing, what type of traumatic event, because remember, the event is the trigger, trauma is the response. So we got to keep that in mind. So if at any point in time you have been exposed for prolonged periods of time to trauma, it is recommended that you seek professional help. If you are not ready for a therapist or it doesn't do it for you, there is plenty of apps out there that can help with this. I like one that is called Copy Mind AI. It's kind of neat. So that is one to kind of like keep in mind and maybe utilize if you're going through trauma exposure. The other thing that social workers need to be extremely mindful of and careful of is vicarious trauma. And this one gets a little bit more tricky because there's an element of choice sometimes when we're having vicarious trauma, right? A lot of the times, if you if you have chosen to be a social worker, you have chosen to experience vicarious trauma. It's the nature of the beast. It comes with the territory. So knowing that and being equipped with that knowledge, it makes it even more vital that you practice self-care and that you set boundaries early on in your career, because you already know that this is coming. You know that you are going to be exposed to stories of traumatic events, very disturbing situations, very high demanding situations, high adrenaline situations. So at least here you can be a little bit more proactive because it is something that you know will happen. You might not know when it's going to happen or or what vicarious trauma might trigger you or trigger a response on you, but you know it's going to happen. So at least you can choose to address that in the way of self care, in the way of therapy, in the way of a hobby, whichever way you choose to address and metabolize that trauma that is not yours, but you are being kind of like looped into, is affecting you and how to uh, move it along as best as possible. And then the last thing, and the one that is I am so sorry because I'm trying to like honor the chat. Hi, Joel or Joel. um, I see that you retracted your message. I'm assuming it was one of the rude ones. Um, yeah, I'm sorry. I keep having to entertain the chat, even though it's been a bunch of trolls today that have been just trying to derail um, an important video. So the last risk, and the one that I really, really, really want to encourage social workers to monitor yourselves for, is burnout. Now, falling into burnout is very easy, especially in what we do. It doesn't take much. It doesn't take a whole lot of trauma exposure. It Burnout can creep up on you fairly quickly. You could be a social worker that has been doing this for months and already be burnt out. It depends on your caseload. It depends on the type of social work that you are conducting. It depends if it's clinical. It depends if it's more community related. But burnout is when you kind of like hit the I don't give a button. That's what burnout feels like. You literally lose all capacity to show empathy, to show grace, to make the best decisions, best on your patient's or your client's best interest, because burnout does not allow you to engage in critical thinking and de-escalate and utilize your toolbox efficiently. When you are burned out, you need to remove yourself. You need to take a break. That is the time for you to take a vacation, take a family leave act. I know we live in a country where we can't afford to take family leave acts. I know we live in a country where you can't afford to probably take a little sabbatical to take care of your mental health, because we do not get good health insurance, good pay, good anything. But if you catch yourself with the symptoms of burnout, where you are making poor decisions at work, it is now directly affecting your attendance, is affecting how you show up for your family, it's affecting how you perform at work. Look for help. Let somebody know, and remove yourself as much as you can. Um, make resting. I know it shouldn't be, but it is a radical act. Um, and you should allow yourself time to rest and recover and care for number one, because you cannot be efficient at your job, at least not in a sustainable way, if you are not practicing self care and you are not showing empathy to the person that you need to show empathy first, which is you. So, anyhow, that's all I had for today. Again, I want to celebrate all of my peers, all of my social workers out there. Happy Social Worker Appreciation Month. If you are a social worker, if you know a social worker, get out there and let them know that they are greatly appreciated. Okay, this is their month, so let's get out there and celebrate them. And as always, stay safe, stay healthy, and keep lifting each other up. I'll be talking to you guys soon. Bye bye.